Coronavirus pandemic continues to wreak havoc globally and in our country. As at yesterday, 10th April, the infected cases in our county, in our country, stands at 189, with 22 recoveries and 7 deaths, spread over 10 counties, the 10th county being Mandera. The disease has not spared our neighboring Mandera County, where 2 cases of recent travel from Kilifi County are now recuperating in Mandera County Referral Hospital. Despite having no cases in our county, we are awake to the dangers posed by the continuous travels and contacts in and out of our county from all ends. With this in mind, we had our 20th County Executive Committee meeting and the 4th County Emergency Response Committee meeting on coronavirus disease, geared towards discussing our control measures and how to keep our people safe. Towards discussing our control measures and how to keep our people safe. I, at this juncture, thank the County Emergency Response Committee, the county officials, partners, and particularly the Department of Health for providing frontline services in the prevention of COVID-19. Ladies and gentlemen, in order to combat the threats emanating from COVID-19, we have to therefore mobilize resources to effect more stringent measures, and these include: 1. County government of Wajir has allocated 194,820,000 Kenya shillings from various departments to combat this disease. 2. We have formed a 9-member committee chaired by the CEC Health, co-shared with the CEC Finance, to come up with a realistic response to boost the interventions already in place. 3. We have procured the essential equipment and supplies necessary in the prevention and management of COVID-19. These include, among others: 1. 7 ICU beds, which you have just seen. 2. 7 ventilators. 3. 6 bedside oxygen monitors. 4. 2 cardiac monitors. 5. 100 hospital beds. 6. 1,000 hand sanitizers. 7. 50 thermal guns, the ones for measuring temperature. 8. 150 hand washing facilities, those containers, like the one we saw there. 9. 140 pairs of gumboots. 10. 60 spray pumps. 11 aprons and face masks. Number 4, we also received a 40-feet container of medical supplies from the United Mission on Relief and Development, containing sanitizers, gloves, face masks, and others, as part of the consignment that are very useful in the prevention of this pandemic. We have also received 420 liters of hand sanitizers from Kenya Pipeline, and it is at Garissa. I think we will receive this morning from Garissa, and will be delivered to all the sub-counties. We thank both organizations for the support and direct the Department of Health to immediately distribute the supplies to all parts of the county. Number 5, I'm alarmed, or we are alarmed as a committee, by the failure of our people not to heed the national guidelines and protocol in the prevention of this pandemic. These protocols include maintaining social distance of about a meter, washing hands with soap and water, desisting the handshaking as a sign of a broker deal, and putting face masks at crowded places. To this end, my government will reactivate and insensitize the community health volunteers in all the villages to upscale health education and adoption of the desired health practices in their villages. We shall provide a monthly stipend of 5,000 Kenya shillings to each of these volunteers, so as to motivate them and discharge the tasks more effectively. The committee is working on the number of volunteers we require in the county. 6, in a bid to decongest and adhere to the social distance protocol, the food and vegetable vendors at Sokomujinga 1 shall be relocated to the new market latest by the end of today, 11th April. Those who wish to relocate to other satellite markets are encouraged to do so. Number 7, we shall embrace salary cuts effective from this month, so as to adhere to the presidential directive as follows. Governor and Deputy Governor, we will surrender 30% of our salary to this kitty. The County Executive Committee members, 20% of their salary will be deducted, and it will continue until this pandemic is over. Chief officers and officers on Job Group S, 15%. Directors and other county job groups, 10% and below. I therefore appeal to each one of you to contribute towards this kitty. Intervention number 8. While we will continue to comply to the presidential directive of not curtailing food and essential supplies movement, the said cargo vehicles should not be carrying more than 2 persons and the driver. So in total, they have to be only 3. If they carry 4, including the driver, it is an offense. That vehicle will be locked in. Further, we will remain vigilant on the unwarranted movements of PSV and other private vehicles carrying passengers, especially from the affected counties. But here we are saying whether a county is affected or not, as long as it is bordering Wajir, and whether people come from Mandera or from Moyale or from Nairobi or Garissa, no, we have locked down all these passenger and private vehicles. Towards this end, I direct lockdown for all PSV and private vehicles traveling from any of the neighboring counties on expiry of 24 hours notice, beginning now. I appeal to the law enforcement agencies, the public, and other relevant stakeholders to cooperate in complying with these directives. Please send to all your friends in Nairobi or Garissa. Let them not travel. Should they travel, we will apprehend them here, and whether somebody is sick or not, they will go to Wajir girls and we will quarantine them here. Now Ataka, at their own expense, we will not give them even a bottle of water. So tell them, please, that message should reach everywhere in the country. Number 9, the CEC Health shall provide regular media briefings as we continue to monitor the situation. Number 10, let us continue with the awareness campaigns at the markets and places of public gathering so as not to tire from educating our people. Finally, we appeal to well-wishers and the international organizations to support us reach out to each and every corner of our vast county. Thank you very much, and stay home and stay safe.